I love Africa Global
So
Radio.
every year, countries around the world celebrate World Blood Donor Day. Now, the event serves to raise awareness of the need for safe blood and blood products and to thank voluntary unpaid blood donors for their life saving gifts of blood. A blood service that gives patients access to safe blood and blood products in sufficient quantity is a key component of an effective health system. Now, today, we have the privilege of speaking to Mr. Patrick Nsobila. Mr. Patrick Nsobila is actually Deputy Chief Medical Laboratory Scientist, former laboratory uh, manager of the Department of Laboratory Services at the TTH, talk about the Tamale Teaching Hospital. He has just joined us online. Good afternoon, sir, and thank you for joining us on the Africa Daily Show.
Yeah, good afternoon. Afternoon to your listeners out there.
All right, thank you. Sorry for the technical glitch. You know,
Mm,
is one of those things. Yeah. So today we're
mm.
observing World Blood Donor Day. First of all, Doc, please tell us what is the importance of blood donation? How do we? I mean, what are some of the importance of donating blood?
Yes, first of all, the most important thing, blood and blood products have become an integral part of our healthcare delivery system
Okay.
because the therapeutic use of blood has become so important that we don't have effective alternative
Mm,
for conditions that require blood transfusion. So the importance here cannot be overemphasized. There are some conditions that if we don't have blood or blood products, they will lead to morbidity and mortalities.
right.
So it's very, very important. It has become like one of the most important single philanthropic gift anybody can give to the healthcare delivery system because the blood will support services and save lives.
Mm,
So that is a very important thing. That's why this World Donation Day is so important. And this year we have the theme Give Blood and Keep the World Beating.
right.
It means blood has become part of the system that can keep hearts of people pulsating because it supports to save lives.
Mm,
There are a lot of medical interventions, but interventions that require blood transfusion become so important that you can't do anything without with any alternative to treat those conditions. So it's very, very important.
okay. Now, Doc, tell us who qualifies to donate blood.
Yes, for example, in Ghana or worldwide, any
Right.
person who is clinically fit and of age between 17 years to 60 years with a normal hemoglobin level and a minimum weight of 50 kg is qualified to donate blood.
Okay.
But it's a process, a whole lot of assessment to make when before you donate blood, they'll make assessment, clinical assessment to make sure clinically you are okay, you are not running temperature,
Okay.
medical assessment to make sure medically you don't have, for example, if you have an underlying heart disease or a recent surgery,
Okay.
these people are advised not to donate blood
No.
and we make lifestyle assessment to actually determine the lifestyle of the person, the movement, just to be sure of medical conditions that might be imported from other areas to the donation area. So anybody who is 17 to 60 years
Okay.
and with all this condition and with all this assessment made
Mm.
qualifies to donate blood.
Okay. So anyone below the weight of 50 kg who is medically fit, is that person qualify or not?
No, if it's below the minimum weight, the minimum weight,
Of
the
50
person
kg.
doesn't, yeah, that if it's
Right.
below the minimum weight, the person will not be qualified to donate. It can,
Irrespective of how fit you are medically.
yes, because
Okay.
in blood donation, we are protecting the donor as well as the recipient of the blood and blood product.
Right.
So some of these things is to be sure we minimize
Okay.
any
Okay.
adverse effects on the donor.
Right. Now, you have been a former laboratory manager of the Department of Laboratory Services at the Tamale Teaching Hospital. And, every now and then we hear issues of shortage of blood
Yeah.
in the blood banks and what have you. And what do you think is the reason, first of all?
Yeah, first of all, in our part of the world,
Mm,
worldwide, what quality blood systems strive on
mm,
is 100% voluntary, non-remunerated blood donors. But in our part of the world, unfortunately, we
mm,
don't have that. We depend solely on a greater percentage, more than 60%, come from family replacement donors, and which is not a reliable source. The infection rates are higher. So it creates conditions for shortages. And there are also people who might not come from families that have people fit enough to donate. You can imagine an old woman living with a grandson
mm,
and they need blood and they need to donate for the child. It becomes problematic.
mm.
That is one of the reasons why we have the shortages.
But what?
But I think with the establishment of the National Blood Service, we
Mm,
just have the National Blood Service Act 2020, Act 1042 passed,
okay.
with the overall objectives of providing safe and adequate blood and products to patients who require transfusion therapy in our public and private health facilities.
Okay.
I think that strategy might improve the present condition of
Mm,
frequent
right.
shortages of blood.
Right. So why do you think people are reluctant to donate blood?
Yes, at times this reluctance stems from misconceptions,
Mm,
misinformation,
okay.
and lack of proper education on the benefits of and the importance of blood donation.
Mm,
And blood donation, I think what overrides is the humanitarian value, because if you donate a product that you save somebody's life, and
right.
at times one donation can save three people, because we can separate the blood to various components and to save 3 or 4 clients at a go.
Okay.
And if the education doesn't go well, people even think that when you donate, you can contract HIV and all those things.
Yeah. Yeah.
So this kind of misinformation makes a lot of people reluctant. But
Okay.
I think when we are doing the blood drives, we try to pass in the appropriate the appropriate information,
Mm,
because blood donation is not so painful. It doesn't last too long. Maximum 15 minutes and you are done. And when you follow the professional, the advice from the professional leading you through the processes, you might not even have adverse reactions,
right.
and you become satisfied. And
Mm,
know the point, frequent blood donors to it becomes a form of exercise on their hemopoietic system and their immune system. So they
okay.
tend to be healthy. And apart from that, you get that prestige in society. If you are
Mm,
somebody who is donating blood and saving lives, you
right.
become a stakeholder in blood policies, and you get a little bit of recognition
Right.
and prestige,
Mm,
you
mm.
know.
Okay.
So, yeah.
Let's talk about side effects to blood donation, because one may worry if I should donate some ounces of blood, I may suffer some side effects. How true is that?
Yeah, really, when the processes, there are side effects, but when the procedures are well followed, these side effects are actually minimized or eliminated. But we have side effects like people feeling dizzy as a donation, people fainting, maybe there can be accidental nerve damage, hematoma at the side of the puncture, and at times infection.
Okay.
But because of that, with our national blood system, we have as part of the objective to strengthen the workforce and make sure professionals, well trained, handle these processes.
Right.
And by so doing, we eliminate some of these side effects. But really,
Mm,
it's possible if somebody has a venipuncture, you expose it, you can get an infection through that. But if
okay.
you follow the guidance and the counsel of the professionals taking your donation, they will advise you, and some of these side effects might not come.
Right.
And they fainted to at times. People maybe they haven't eaten for long, and this the
Yeah.
volume of liquid taken out of you.
Mm,
So we need to think of that equilibrium
Mm.
to be able. At times, people donate and they want to just get up immediately. It's not
Yeah, it's not
advisable. You
advisable.
need to relax for
Mm.
the system to get some level of equilibrium.
Okay.
Then the person gets up and they
Mm.
are good to go.
Right.
You
So
know,
so
so
so mm. So
it,
if one is medically fit and goes through all the clearance after donating, rarely would one experience side effects. Is that correct?
yeah.
Okay.
Mostly you don't feel and
Right. Right. Okay. So, Doc, tell us. We also hear issues of certain blood types,
yeah.
where you are one who is in need of a blood donation, but then they go and then the person's blood does not tally to the one that is needed. Maybe this person is in the group A or is in the group B and
Yeah.
everything. But are there instances where you organize an exercise that is targeted at a certain blood group where you have blood you have blood at the blood bank, but the
Mm.
ones that are needed the most are maybe of a different group? Do you organize instances where you target people of a specific blood group, or when you just do general blood donation thing?
Yeah, normally because we have the blood banking system,
Mm-hmm.
normally we don't do targeted blood donation, group donation. But there are some groups that, for example, when you take a group like O negative,
Okay.
the peculiar thing about O negative is that it doesn't, in terms of the cell, it doesn't accept blood from other groups. So it means if I'm O negative, I necessarily need O negative. Not when I'm A, I have the possibility of taking O or A. So the
Okay.
chances of getting blood wider.
Mm.
So these are the only instances whereby we have a system of tracking the voluntary donors. Those are regular.
Mm.
And when the need comes, they are called upon to come and donate those rare groups. But in general terms, when we are doing blood drives,
Okay.
we just pick all. And because we have a banking and an efficient distributing system,
Right.
it doesn't really matter.
Mm.
But to a large extent, because of the data and studies we have, when we are taking voluntary donations, we target low risk populations.
Mm-hmm.
And in the same vein, we are able to also study the demographics and know which areas have this kind of rare blood group, for example, O negative.
Okay.
So it's easy to have those ones so that we don't run in stock. Because if you can have 1,000 units, but if you don't have O negative and somebody is O negative, it
Right.
becomes difficult to replace
Mm.
if you are supposed to give the cells.
Right.
Other components you can cross, but if it's the cells, it becomes difficult.
Right.
So the only peculiarity is the O
The O
negative.
negative
Yes, but
carriers. Right.
generally,
Mm.
all the groups, we just take them without
Okay.
being too specific because of the system of banking we have.
Right. Mm. Now, Doc, does blood expire?
Yes, the blood expires depending on the blood bank you use. Mostly we have those that expire in 42 days. But commonly we have those that expire in 35 days. You know,
Okay.
there are preservative there, but depending on the storage condition, when they are stored between the temperature of 2 to 6 degrees in our settings,
Uh huh.
they can take up to 35 days
Wow.
before expiration. Yes.
Wow.
So
Mm.
mostly it's not kept forever.
Mm.
But some of the components, you can store them minus 40 degrees. For example, fresh frozen plasma, you can take up to 1 year. Even
Okay.
the cells, there's a way of treating it and be able to freeze it, and it takes
Mm.
long. But ideally,
Right.
the blood bags, depending on the specification on the blood bag,
Yeah.
it's
But
42 to 35 days.
35
And
days,
they
1 month
expire.
and some
Yeah,
days. Wow.
yeah,
Now, you have been in the, medical laboratory space for so long, and I believe you've witnessed the behavior or the culture of Ghanaians,
yeah.
Africans generally, towards blood donation. What would be, your advice to encourage people to donate blood?
Yes. At times, I always say the way we package information, we have to also think of our culture. Africa in general,
Right.
when we do favors, we like to be say to receive thank you.
Mm.
you know. But when it comes to blood, it becomes difficult. Thank you is not enough. So I
Right.
always tell people,
Mm.
just think that You are giving blood to save life. The
Yep.
inner satisfaction of saving life
Right.
should be a very serious motivating factor.
Mm.
And when you look at Ghana, most of the blood consumption rate, when you look, it's women of childbearing age, children, because of malnutrition,
Mm-hmm.
infection, and all things, they easily get anemia. So these are the vulnerable group your blood donation will support.
Okay.
So you should be feeling very excited that maybe a unit of blood you donate can save a child
Right.
who is living less than 1 year,
Mm.
can save somebody's mother or somebody's wife who has come to give birth. There's nothing more painful than somebody trying to give birth and
And they
loses their
pass.
life
Mm.
during the process.
Right.
So I think these are some key humanitarian values that we can imbibe in people and encourage them to see to it.
Mm.
And the hassle at times, scarcity brings a lot of compromise and a lot of strife.
Right.
But if we all agree to regularly donate blood, it will be abundant.
Mm.
The quality will be assured, lives will be saved, and we all feel like humans with love for our fellow human beings.
Right.
I think this is a message that we need to spread to our people to forget of the culture, because the person doesn't even know where the blood is coming from in order to come and thank you. But at
Exactly.
least if you do a favor that saves life, even without receiving thanks, I think God will richly bless you
Okay.
for that particular gesture.
All right. Okay.
So,
Right. But before I let you go, Doc, my colleague here also has a question for you. So, Hafiz, Doc is online.
Dr. Patrick, thank you very much for joining us.
yes.
Good, good. Yes, I just have this simple question. I mean, I want to know the conscious efforts that the various health institutions are making in, trying to retain some regular blood donors.
Yes, mostly most health facilities, we even have a cadre of professional called blood donor organizers.
Okay.
They keep track, they keep motivating those donors with speeches. And what part of the reason why we celebrate Blood Donation Day is not just to advocate for the importance of blood, but also to acknowledge the critical contribution of voluntary blood donors.
Okay.
So these are people that we have various professional, this cadre of professional group trained to add value and give them information, make them feel important, because their gesture of giving blood is a very, 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 very important thing. And blood has no replacement. We have alternatives, but they are not as effective as the blood itself. A condition that needs blood, you can't treat without the blood. You can't get alternatives that will sustain the person alive. So we have this conscious effort. There are some times when we go for donation drives, we are able to give them branded T-shirts, and just as a token for the person to feel a symbol, to feel that they've done something that society appreciates. And we appreciate them because they are very, very important source of the resource or the source material that we can use to support healthcare delivery system. So there are a lot of things in that regard. And we are even, we have days we celebrate those who achieve a certain number of donations over the years. For example, you are a blood donor for 5, 6, 7 years. We organize dinners to appreciate them and give them a token, give them citations, just to encourage them. But for taking somebody's blood to save life, you can't pay the person enough.
Right.
You can only encourage and appreciate them for them to feel that you recognize their important gesture, but not to pay them as such.
All right. Quickly, before you go, you mentioned some very interesting numbers in terms of the expiration dates for blood. Now, some I'm thinking are so short. So, what exactly do you do to minimize waste?
Yes, part of the effort we do, that's why I made mention of the National Blood Service. Part of the activities is to also encourage efficient use of blood and blood products. And we have a system that tracks the stock levels across the facility. So, for example, from teaching hospital here, there are sometimes we send blood to Walwale, the zip line delivery center, so that they can distribute it to facility along that enclave, so that you don't keep it until it expires. So as exploration of that is not a bigger problem now because of that system of communication. You link with other facilities. There are times blood can even be sent from Accra to Tamale, yeah, through
Right.
flight, and just to make sure, because as
Okay.
I said, it's demand based.
Okay.
So, for example, if you don't have platelets concentrate in Tamale here, and you can get it in Kumasi within a matter of a few hours of flight,
Right.
why not? You can transport it
Okay.
and in order to not to let it go waste.
Okay. Before we let you go, Doctor, my other colleague Epi also has some questions. I believe one or two. Okay, Epi,
Yes.
go.
So, I just wanted to find out that what do you believe the government can do to make the whole blood donation thing and the service work much
Yes,
better?
I think government can play a big role. I was saying that even at the launch of the zipline delivery system, I made a suggestion there. I said you can create a digital platform to motivate young people. Maybe you can even get free laptops, free tablets, and network them. It will give encouragement. So government can do a lot in terms of policy direction. In other countries, even blood to be a donor, it is a sign of patriotism. So government even at employment interview, this are here we say, have you done national service? They will ask, have you ever donated blood? Such a policy can make everybody be eager to enroll our blood donation. So government policy wise, there's a lot government can do. At least
Mm.
the first step has been taken by getting the National Blood Service Bill passed. So it's an act of parliament now, and I think it can empower that agency to come out with policies and strategies to uh, make sure we have quality and adequate blood supply in this
Okay.
country. So the government can do a lot.
Mr. Patrick Nsobila, thank you very much for your time and efforts for joining us on the Africa Daily Show. We will definitely reach out to you if the need arises. Deputy Chief Medical Laboratory Scientist. Thank you very much.
You're welcome.
Okay. And that was Mr. Patrick Nsobila, Deputy Chief Medical Laboratory Scientist. And a former, laboratory manager of the Department of Laboratory Services at the Tamale Teaching Hospital. So we're back in the studio now. It was a bit rusty trying to connect, but it went really well.
Yeah,
Doctor knows his chess games, right? So I think I was actually surprised that blood takes that short period to expire. I thought maybe we're looking at maybe a year, be- maybe because of the storage,
Units.
exactly units. Maybe because it's been stored properly, it would take maybe 6 months or 1 year before. Because trying to get people to donate blood is hectic. It's not an easy thing to do. In as much as you go out to the public, create awareness, but still people find that reluctancy of not donating. So I was,
Well,
yeah.
in terms of the the number of days it takes to expire, yeah, I was also shocked to see that. But then, if you think about it, you realize that not all blood types are the same. Yes, and even in terms of the contamination levels and everything.
Right.
Yes, so they are different and for different purposes. So
Right.
you would understand why some would take longer. Some would be in the storage units longer than others. But then again, he clarified certain areas that I wanted
Right.
clarity on, especially on what exactly, my first question, how they are able to keep people that regularly do these
Yeah.
things. Because we have people that do it out of altruism. They just feel they are somehow
It's for
bound
humanity, yeah.
to do it. They just feel
say,
bound to
yeah.
do it. And they regularly, and you'll be surprised at how committed they are in doing it. And so I just wanted to know the motivation. What exactly do they do to actually
maintain.
yes, to keep them coming back, because yes, even though they are doing it, but at some point, some would, every now and then, they would feel reluctant. So, what exactly are they doing to
keep
it
these
all
loyal
yes, and
blood
everybody loves to be
Oh,
appreciated.
yeah,
So,
yeah, yeah.
and in that instance, if and he mentioned how they give them citations, tokens, and what have you.
Yeah.
Well, it pales in comparison to what exactly it is they are giving out. But
Exactly.
at least it is something
Absolutely.
to try to keep them.
Mm.
But largely, I mean, my takeaway in all of this is that I don't feel. I mean, you mentioned in your question that why is it that some are feeling reluctant?
Mm.
I don't think it's a question of reluctance. I just feel it's a question of availability. How readily available some of these mobile units are. If we could have one that makes a mobile unit
It's
that moves,
easy.
yes, from place to place, say office spaces,
Mm.
where to just to get people to find out if there are people that will donate. I'm sure they will get a lot of numbers. Yes, some people don't make it to these places because, well, they simply don't have the time.
Okay.
Yes, and if they don't even have enough motivation to go.
Right.
But what if we have these services come to them instead?
Mm.
So that, I mean, you have a regular, a van or something that goes around
Goes around. Yeah.
these places. I
Mm.
mean, I'm sure you get a lot of people.
Right.
Like in my case, it
Mm.
wasn't something I consciously went out to do, but
Right.
immediately I got the opportunity, I did it.
You did it.
I don't know if you get me. So, and I'm sure there are lots of people out there that simply, have such a mentality.
Right.
It's not like he doesn't want to do it. And of course, there's that category that has a thing against needles.
Yeah.
Well,
Yeah.
they are a special group.
I
but
know, right?
of course,
Okay, let me hear my colleague Epifania on blood donation, blood donor day today. Epi,
Well, this year's theme happens to be Give Blood and Keep the World Beating.
right?
And I think it's a good, I mean, the heart pumps blood. So, yes,
Mm.
it's a good thing. Now, one of the key things, their specific objectives for this year that they're focusing on
Right.
is to thank the blood donors in the world and also create wider public awareness of the need for regular unpaid blood donation.
Wow.
And then also they want to promote the community values of blood donation when it comes to enhancing community solidarity
Okay.
and social cohesion.
Right.
And they also want to encourage the youth to embrace a humanitarian call
Mm.
to donate blood and then inspire others to also do the same, which I think is very important.
Right.
And then they want to celebrate the potential of the youth as partners in promoting health.
Great.
Yeah, so I
Great.
think that these are great objectives that
Mm.
they're actually focusing this year's campaign on. And blood donation is good, except if probably you tried and then they said your blood was not like the way
Have you tried before?
I tried, but then my blood count was low, so
Okay.
I couldn't donate.
Mm.
That was a bummer, but it's better that I'm alive than I try and die.
Right. I know,
Yeah,
right.
so I feel if you can,
Mm.
I mean,
And
go
you're
out there and
medically
do it.
fit, you
yes.
know, yeah,
50,
should do so.
50 kg
50
and
kg
above.
or above. Yeah, between the ages of 17 to 60, you're good to go. Maud, have you ever been to a health facility and asked them, so you know what?
No, I think I remember when I was in either SS2
Okay.
or SS3.
Mm.
They came by our school
Right.
and then they were taking the blood of people. And then
Mm.
I tried,
Mm-hmm.
but I think I had just finished my period. So
Okay.
my blood count was kind of
Low.
so I couldn't donate. And it's like every time I check my blood count, it's like low. It's like below 13. And for an average woman, your blood count should be like 14 and above.
Mm.
So like every time I check, my mom works in a clinic, so I
Yeah.
go there sometimes and
To
then I
check.
check.
Mm.
Then like my blood count is always low.
Mm.
So then it hasn't motivated me to donate,
donate.
blood.
Mm.
But I mean, if an opportunity should come around, I'm sure I'll try again because
Right.
who doesn't want to save lives?
Absolutely. Okay, thank you guys for sharing. Any takeaway from Doc's, submission?
I like the part where Hafiz asked what is being done to retain
maintain the relationship.
between
The
relationship between
active.
blood donors, and then he talked about how some years they do debtors and all that. I think that is good
Right.
because if people are doing something out of their free will and they are not, it's not like not being rewarded. It's like they are not being
Appreciated.
appreciated.
Yeah.
Yes, that is the word.
Mm.
They will feel like I'm doing this, and it's like nobody even cares. Like
yeah.
we're humans. Humans feel like that.
Yeah.
So I think that is great. And then he spoke about how a lot of education has to go
Now the
into
misinformation around
because
that.
because we do not. I think if this day should pass,
That's it.
a discussion on blood donation
done.
would never come up until
The discussion on blood that would come up is that there is shortage. No, I'm serious.
oh yeah,
I don't know why you're laughing. Is that not true?
yeah, that is true.
But that's-
That is true.
When does that discussion is there a shortage?
And then
Isn't that
it's,
a discussion?
it's
It
either
is.
that or maybe you see a post on social media somewhere where somebody is saying, I'm in the hospital and my mom or my
I
dad
need
needs
bl-
blood.
yeah.
So if you're
You know.
around and you're this blood type,
Mhm.
you should come around. And I think education needs to be given on people's blood types. Because
Yeah.
if you know your blood type, then when you're going to donate blood, it makes it even easier
Right.
to donate, especially when they are looking for a specific type
I
of
mean,
blood.
as he mentioned about the O negatives and all of that.
Yeah,
very
the
rare
Hafiz.
donors and all. But we have O negative and positive. Maybe Hafiz is in the
Hafiz,
positives.
which one are you?
I'm positive.
He doesn't even know. You do?
You see, it's
Oh,
in
so you're
pompous.
right,
I'm a
university.
No,
positive.
I can give to you.
I don't know.
fine.
I don't know my blood group, and
I'm
I
an
think.
I'm an A plus. So,
Well, I don't know my blood group, so
Epi-
You
being
all
as-
can take from me.
Epi, do you know your blood? You don't. Oh dear. Okay,
so
that's fine.
I think while we are giving education on blood donation, we should
Yeah.
be giving education on people knowing their blood types as well.
Okay. All right. Thank you very much, guys. And that's it for today's discussion zone, where we have, successfully, in as much as we had a bit of technical hitch at the beginning, but it was successful, speaking to Mr. Patrick Nsobila, Deputy Chief Medical Laboratory Scientist, former manager at the laboratory services at the Tamale Teaching Hospital, and it gave us an insight, conversation surrounding blood donation and all of that. Thank you. But watch the video on our YouTube page, Africa Global Radio. Subscribe as well as get to listen to the audio version on demand on AfricaGlobalRadio.com.
I love Africa Global Radio.
If you enjoyed this video, don't forget to like it, subscribe, and share.